Victoria has recorded 11 new cases of coronavirus in the past 24 hours with no COVID-related deaths. It comes as authorities in New South Wales try to determine the source of 3 mystery cases. The infections have cast doubt on the reopening of the Queensland border to the rest of New South Wales. Well, let's get the latest. Reporter James Hancock is in Melbourne, Alexia Atwood is in Sydney, and Michael Rennie is in Brisbane. Morning to you all. First to James in Melbourne. Take us through today's numbers from there.
Lorna, good morning. Unfortunately, Victoria is back in double digits. 11 cases today compared to 6 yesterday. Melbourne's 14-day case average has dropped slightly to 9.7, but the number of mystery cases is up by 2 to 14. Hopes are still pinned on a significant easing of restrictions in Melbourne in less than 2 weeks. The target is a 14-day case average of 5 and the same number of mystery cases over that fortnight period. But Lorna, time is running out.
And James, what about Victoria's hotel quarantine scheme? That seems to be under scrutiny once again.
Claims that will alarm Victorians this morning after months in lockdown after a second wave of the virus linked to the state's botched hotel quarantine program. A worker says that within days of working here, staff were deployed to Melbourne hospitals, risking the spread of the virus. He also says that contractors have worked as security guards here under the revamped hotel quarantine program, and that former bouncers with little experience have been leading security teams. That's at odds with government assertions that only police have been securing this hotel, the Novotel here at South Wharf. The worker who the ABC has spoken to is employed by Spotless, and he has spoken out concerned about the way this is being operated. Spotless is contracted by Alfred Health to provide non-clinical support here at this quarantine hotel, which is currently accommodating people who need somewhere to self-isolate. Alfred Health says that staff are being tested for the virus before being allowed to work, and the government says that these Spotless staff are in customer service roles only and are wearing full PPE. Lorna?
James, thanks for that. From James in Melbourne to Alexia Atwood in Sydney. Hi, Alexia. What more can you tell us about these new cases in New South Wales?
Hi, Lorna. Well, unfortunately, that's just it. They are mystery cases and we just don't know much about them. We know they're not linked to each other and they're not linked to any known clusters. And it has broken this 12-day streak we had going in New South Wales of no community transmission. So the Premier Gladys Berejiklian says that, well, this just proves that the virus is out there. We cannot get complacent, and it is likely that we are going to have community transmission until we find a vaccine. Now, these 3 mystery cases have been located in 3 local government areas spread out across Sydney. That's Parramatta, Campbelltown and Wallandilly local government areas. Now, these 3 people have moved around the city quite a bit. There are health alerts for the Ripples restaurant at Milsons Point for people who were there last Saturday night, and also for a Pilates class at Fitness First in Carlingford on October 3rd. So these people who are there at the same time are going to have to go into isolation for 14 days, and there are a series of health alerts issued for around the city for people who are considered close contacts. Now, traces of COVID-19 have also been detected in sewerage catchments at North Richmond and West Campton. So people are being encouraged to get tested. Testing rates have been worryingly low in New South Wales. That was particularly the case over the long weekend. They have ticked up a little bit. Authorities are encouraging us to go and get tested at the slightest sign of symptoms so that we can get on top of these mystery cases and hopefully they don't grow into bigger clusters.
Alexia, thanks for that. From Sydney up to Brisbane then, and Michael Rennie is there for us. So these mystery cases, Michael, what does that mean for the reopening of the border?
Morning, Lorna. Well, it certainly puts that into question this morning, and the border was set to reopen on November the 1st, which is great news for people who live along the border, great news for businesses, for tradies, for tourism in both states, and just for people who haven't seen family and friends for a very, very long time. But the Queensland Premier, Anastasia Palaszczuk, she told the ABC yesterday that even if there is one case of community transmission that they cannot trace, well, the borders will remain closed. And the clock is ticking for New South Wales authorities. The Queensland government has given them 48 hours to scientifically track down these mystery cases in the state at the moment. The Deputy Premier, Stephen Miles, will speak about this morning. He'll address this issue this morning. But the New South Wales Premier, Gladys Berejiklian, well, she just thinks that the borders will remain closed at this point. She feels like the clock will be reset to 28 days, and she's worried that the borders could remain closed for the entire period of the pandemic, which would be devastating for people on both sides of the border. But the Queensland government consistently says that they are following the health advice, that of the Chief Health Officer, Jeanette Young, and that sees 0 new cases as of yesterday in Queensland, 7 active cases and over 4,000 people tested. This is all happening as the Queensland election gets underway this week. Lorna, both sides of politics are up in the north of the state today. The Labor government, Premier Anastasia Palaszczuk, is in Townsville, 3 important seats there that they need to retain, and also the LNP in Cairns. So far, manufacturing and construction has been the main points that they've both addressed, but surely tourism, that they're in the north of the state, tourism will be on the agenda today.
Indeed. Let's thank all of our reporters, James Hancock in Melbourne, Alexia Atwood in Sydney and Michael Rennie there in Brisbane. Thank you. Now let's get more on the loosening of South Australia's border restrictions today. The new rules mean travellers from New South Wales can drive through Mildura on their way to South Australia, but strict rules still apply for residents in Victoria. To help explain, reporter Chris Tester joins us now from Callala. Hi there, Chris. What's changing? What's happening?
Yeah, good morning. Basically, things are now easier for New South Wales residents in the far west or the west of the state who are wanting to travel into South Australia. They have, of course, been allowed to do so for the past couple of weeks, but they weren't previously allowed to travel through Victoria. Now, as you can see here, the Sturt Highway travels through Victoria for about 140 kilometres. That's the main route from Adelaide to Sydney. So South Australia is now allowing people to use this Victorian section of highway to get into the state from New South Wales. One of the conditions, though, you're not allowed to stop anywhere along the Victorian section of highway. Not allowed to stop in Mildura or at any of the service stations along the way. So you do have to cross in from one of 2 bridges in the Mildura area and then make your way directly to the border checkpoint at Yamba before crossing into South Australia. And that, of course, will make life a lot easier, though, for residents of southwest New South Wales who would have otherwise had to take a 450 kilometre detour through Broken Hill or travel for about 70 to 80 kilometres on an unsealed road.
How, Chris, are people coping with these border rules in the area where you are?
There are, I guess, mixed reactions to this. For people who live in Mildura, this is a tri-state community. We're right on the border with both New South Wales and quite close to the border with South Australia. Mildura's 50,000 or so residents still don't have access to South Australia. It's the closest capital city. They're very frustrated. They really have lobbied for the Premier of South Australia, Stephen Marshall, to allow them to enter South Australia because of the low number of cases over the course of the whole pandemic. But regional Victoria remains locked out. For people who live in New South Wales, it's a lot easier for them. There is, of course, a restriction, though. You can't actually go into South Australia if you've been in Victoria for the past 14 days. And that confuses people. That makes life difficult for people in towns like Baronga and Wentworth, because many of them live in New South Wales but work in Victoria. They go to their doctors' clinics in Victoria or they shop in Victoria. And if they want to go into South Australia, they have to stay out of Victoria for 14 days. The other element that's confused people from further afield is the rules are actually different to use this Victorian section of highway depending on which way you're travelling, because if you're heading back to New South Wales, even if you're a New South Wales resident, you do actually need a permit to get back in. So New South Wales doesn't want people using this section of Victorian highway on their way back to the state.
All right, people better read the rules, hadn't they? Chris, thanks very much for that.